In today's episode of the podcast, we're going to be talking about the worst movement that you can do for a herniated disc in your lower back. This is L45 or L5S1, the last two segments in your lumbar spine. And this is particularly for you if you are someone who likes working out. You've been given that diagnosis of a herniated disc. Working out has been a part of your life, for a long period of time. And really, it's quite a setback when you get told, hey, look, you're not going to be able to do this, or each time you go back into the gym, you put a bit of weight on the bar, all of a sudden you can't do it, and it sets you off, and now you're back to square one again and again, and it can be really, really demoralizing. But if you can understand this particular movement, when it's happening, why it's happening, and how to stop it, you're going to find you can actually get back into lifting weights, back into doing something that you love, and ultimately rebuild the strength of your back in spite of that slipped disc. One of the main reasons that this movement is so easy to overlook is because it is part and parcel of your daily life. You'll have been doing it both in the gym and out of the gym. When you're moving around, your back won't have been taken care of and you'll be getting away with it. Even in the case of many powerlifters at a high level will use this sort of movement to their advantage. But things change when we have a herniated disc. It fundamentally changes the stability of your lower back for a period of time. And if you choose to ignore this, it's one of the root causes of why you're just not able to start loading up that bar again and lifting properly. The movement we're talking about is a pelvic tuck. And what it is as you're going down through that squat or down through that hip hinge, as you get to the bottom, your hips can go no further. The hamstring flexibility is limiting them. The hamstring's plugging into here, and they start to pull on the pelvis and pull on the lower back. And you just allow that movement, that butt wink, that pelvic tuck to take place. And you can see what happens to these segments here, and to a greater degree, but less visible on this spine, the L5S1. It just unlocks those segments. It stretches them out. And if we have a compromise at this level, it's going to really strain that area. This movement leak is a real problem if you have a herniated disc for the simple reason of you've probably spent years training in the gym before you injured your back. And so all of those other segments, the spine should run as a stiff rod so that when the muscles act on the spine, it bends one way or other and all of the joints share in that decoupling movement one way or the other. The problem is now you have a bunch of really strong segments and you have this injured one. And this injured one is going to take that movement, if it leaks, into the lower back. Instead of them all kind of stretching and creating tension around here, it's going to really focus to that one segment. And now all of the movement is going to go through the weak link of the chain. And that's what continually aggravates that herniated disc because it's not healed yet. Fundamentally, when you injure your back, the discs in this case, you get two parts of healing taking place. And the first part is that patch-up work. And this is where you get caught out because the wound, the damage, the ligaments around the disc and the discs themselves, they start to patch up. Inflammation comes down. You're not feeling in pain as much on a daily basis. You think, I'm ready to start lifting again. But the second part hasn't taken place. And that is the reintegration of the strength of that disc into everything else. And remember, if you've had years of training, maybe 5 years, maybe 10 years, maybe even longer than that, and everything else hasn't been injured, and this bit has, even as it starts to go through that second part, the remodeling process, it's going to take a long period of time before the segment that you've injured, let's just say it's L45 here, is as strong or as close to the strength of the surrounding segments. So anytime you allow this movement leak to take place, which you might have gotten away with in the past or will have almost certainly, it's always going to preferentially go through that weaker segment. And as you start to load the weights up, if you fail to control for this movement, that's the one that's going to pay for it in terms of taking the brunt of the load. It's not distributed evenly amongst everything like it used to be. So what are we going to do to stop this setback? Well, ultimately, now you're aware of it, hopefully, you can start making smarter decisions about how to stop this movement taking place. And the very first thing is learning to control and become aware of a neutral spine. Learning to incorporate your core muscles around the sides of your abdomen, as well as the lower back muscles themselves, and even to extension, the lats higher up, and tensing that whole area to create a over-the-top stability to protect that lower back from having to go through any unwanted movement, especially in the lower parts of this rep range, as your hamstring tension or hamstring stiffness, reaching the end of its range of motion, starts to increase the pull on those hips. You need to have the strength in that region to resist the butt wink movement or the pelvic tuck taking place. So we recently covered in one of the videos 5 core exercises, things like the dead bug, things like the squat, the hip hinge, etc. And you can check our link out in the description for that particular video if you want a little bit of guidance. But those are the sorts of exercises that we can start to incorporate to learn to strengthen and stabilize our core in response to various movements so that we don't allow this movement leak to take place. The important thing to remember for those of you that are a little bit stronger is that you will get away with a degree of this movement leak taking place at lighter weights. And you'll think, oh, I'm okay. But don't try and risk it, because for you, as soon as you get up to a quote unquote heavier weight, that's when it's going to catch you. So get it right at a light weight. Don't allow yourself to get away with the movement leaking into the lower back. You'll find you have so much more success moving forwards for the long term. And that brings me to the next tip, which is going to be a tip to really practically help you start to reconnect the connection between your brain, what you think is happening in the lower back, and what is actually happening. So this invaluable test is called the tape test, and we did a video on it quite recently, so link in the description to check out the exact placement of where you should be placing this tape. But fundamentally, it involves you getting into your good starting position for your squat, for example, and this can also work in the hip hinge. It also, by the way, it can work at home. Just seeing what sitting in a chair, for example, might do to your back when you're moving around, and how this movement leak is pervasive into everything you do in many cases. And then you line the tape up from this segment here, the L5-S1 segment, up to the lumbar spine. And as you go through the squat, it will be like a reversing camera on your car. It will tell you, as soon as you start to get that lower back moving, you're going to feel the pulling on the skin, and you know, okay, I've gone too far. And gradually you'll start to become aware of when the tape is about to pull, so you can stop at that point, rather than allowing that pull to go and hammer the L5-S1 segment and then the L4-5 segment without you being aware of it. So again, you can check out the link in the description for that tape test. It's a great one for you to use periodically, maybe right now to help you get a first impression, but also as you start increasing the weights, that movement leak is potentially going to come back in, and it can be a helpful tool there too. Following on from the last point, you are likely to get a relapse again as you progress the weight. Look, your muscles are going to have that muscle memory. They're going to remember how strong they were. They're going to adapt very, very quickly. Your spine is not. And these opportunities for relapse, because they don't need to be a foregone conclusion, but these opportunities for relapse are going to happen when you start to push the weight up a little bit more. And hopefully the next couple of tips are going to help you again further stack the deck in your favor and reduce the likelihood of you getting any relapses. So with that in mind, being someone that enjoys working out, that does jiu-jitsu, which by the way is not good for your back, I don't like when people are told, hey, you're not going to be able to work out, you're not going to be able to do this. But we want to be as sensible as we possibly can going forwards. And that's why this first tip is really, for some of you might be a bit frustrating, but that is avoiding working with low rep ranges. And that's the 3 to 5s. And the reason I say this, and be honest with yourself, you've seen it in the gym, you've probably experienced it yourself. When you're working at 3 to 5 rep ranges, you're working at, you're starting to push yourself and push your limits. But when you quote unquote fail or get to that last rep, it's always a bit of a grindy one. There's always a little bit of wobbling in the lower back. There's always a little bit of this particular movement leak taking place. And comparatively speaking, if we're working at rep ranges of around 10, it tends to be that you have a bit more control at that point over the degree to which that kind of those movement leaks, if you will, are taking place. You tend to be able to control it a little bit better, even as you are fatiguing on those last 1 or 2 reps. And so I think going forwards, for as long as is possible, trying to stick to more things more like 10 reps rather than 3 to 5s is going to be so much more valuable for you. Sure, it's not the most efficient way to build your strength, if you're a competitive athlete, or if you're trying to really push the envelope, but you still can make strength improvements at 10 rep ranges, and you'll just find that for every week, every month, every couple of months, that you can stay at that 10 rep range and continue to increase the weight, you're going to just do so much better and further decrease the risk of problems, risk of relapse, and risk of re-aggravating that disc. And quite frankly, if you're serious about training, you're taking a longer view. You're looking at doing this for the long term, keeping your body fit, healthy, strong. So there's no reason that we can't sacrifice 6 months, a year, 18 months, something like that, of sticking at something like 10 rep ranges before sparingly introducing things like maybe 5s first and then 3s much further down the line. But you'll be able to get some good weight moved at that 10 rep range, before you feel like you really need to use the 3s and 5s. That's where people make real mistakes, is jumping back into those way too soon. So the next tip really pertains to that feeling of heaviness. If you've ever taken the squat bar off the rack and you just feel, this feels heavy on my spine, it's trying to remember what that felt like to a degree. And that's where you really need to dial in that feeling, so when your disc is at the upper limit of what it's willing to bear in terms of the specific load. Even though, as I mentioned earlier on, your muscles are going to be happy to go a little bit further. You can just feel, my lower back is feeling this load as I'm picking up the bar, and I've just increased it this week for the, after 6 weeks at the previous weight, or 4 weeks at the previous weight, but I'm feeling it a little bit in my back. And that's kind of your warning sign. Maybe that's as far as you go for a little while. You stick on that weight for a little bit, and there are a couple of strategies that will hopefully help you stay at that weight and manufacture an artificial plateau. Because remember, your muscles, they're highly vascularized, they're going to respond to training, they're hyper responders relative to those discs and the ligaments of your lower back and the structures that are in that load bearing sort of sequence that need the time to actually adapt. So here are the two strategies that you can use. So stalling number one is going to be using the range of motion. We can all go deeper on our squats, we can all improve the range of motion with a neutral spine, and therefore spending an extra 2 or 3 or 4 weeks at the same weight without pushing up even when you felt like you could, or the muscles felt like they could, gives your spine a bit of chance to have that extra exposure, extra time to catch up. And at the same time, you're making it productive for your own training. Because if you do have a herniated disc or a compromised disc, even as it's healing, it's going to be helpful for you to have better ranges of motion in your hips. So working a deeper squat, a deeper hip hinge to elongate the hamstrings, activate the other muscles a little bit more as we get further down the range of motion, getting a bit more dorsiflexion through your ankles. Those are all going to be beneficial for your long-term training. And if you can use this short period of time to not feel like you're doing nothing, but actually working on a goal for that 4 to 6 week period of range of motion, even though you're not actually increasing the weights, you're still going to feel like you're having a really good session and actually achieving something and moving forwards, in spite of the fact that the weights are staying the same for a longer than normal period. The second strategy is switching over to something like single leg work. And that might mean something like a split squat and using weights there. And you might find, based on how far you are along in this process, that you could probably do the same weight maybe, or close to it, that you were doing on the squat or on the hip hinge. Maybe your back's not quite there and not quite ready for more than 30 kilos or 25 kilos of load, but your legs are way stronger than that, and you could actually do single legs with that sort of load. So that might be a factor that's relevant for you. But even still, even if it's not, and it is a little bit lesser weight that you can manage compared to, let's just say you were back up to 100 kilos on the squat, and that's your kind of plateau point. But you're going to go and do some 25, 30 kilo, 35 kilo split squats. Well, you're going to benefit there. You're going to be able to go lower again. You're going to be able to work that ankle dorsiflexion, really have a good workout on those legs, but also challenge your core in a different way. Playing around with the position you're holding the weight at is, again, going to challenge your body, so you feel like you are getting some benefit, even if it's not pumping those top line numbers up higher, and you're giving the spine that time to continue to adapt. And I would suggest the best way to do this is marry up both of these strategies at the same time. So some of the days you are just working at a deeper squat or a deeper hip hinge or deadlift, and other days you're going to be working on the split squat and just working on that balance side of things. Both of these are going to work really nicely to give you a purpose to your training, to be able to continue to work hard without having to increase the weight on the same schedule. And that allows your spine, your herniated disc, to continue to make that change. One final thing is something that I've been thinking about more recently with members who are in this sort of camp. You've liked working out, you want to get back into it, etc. And that is the use of getting that top line weight when you feel that heaviness and you need to spend a little bit of time at that weight, and incorporating a way of exposing your body to that load regularly in a safe, or the safest possible way. So a little bit safer than the actual squat itself. And that is going to be things like a farmer's carry. So it's something that we'll be talking about a little bit more in future episodes, future videos, etc., with bo00 members and on the YouTube channel. But considering, let's just suppose you're at 100 kilos for argument's sake, and you feel like, I used to do 180 or 100, 160 or something like that, or 200, but this is all my back's happy to bear right now. Doing something like farmer's carries, maybe in one hand, maybe in two hands, depending on your strength and everything else, as a way of, in a nice upright position with the core engaged, the posture engaged, really good posture, walking, 10, 15 steps back, to continue to expose your spine to that load so it can continue to go through that adaptive process, but you're in a really, really safe position. That's another little strategy that you can consider incorporating into your training, maybe a couple of days a week, to really help further that process and continue that stimulation on those discs without you absolutely hammering your legs every single day. So it could be one that you can perhaps include, even if sometimes it feels like that weight is quite light relative to what you used to do. So at the end of the day, being someone that trains, you're going to push the envelope a little bit too far from time to time. Your job, if you use some of these strategies, is to help reduce both the severity, if it does happen, and the risk of it happening, any flare-ups of that herniated disc. And I think if you incorporate some of these tips, you're going to find that with a little bit of humility, you're going to be able to steadily build the resistances that you're using and find that although maybe you've had a lot of setbacks in the past, every time you've tried to get back into training, this time you can do it for good. And ultimately, with every month, every 6 months, every year that goes by, that you continue to effectively incorporate these strategies, you'll find that you are safer and safer and more able to push yourself and you just get back to doing something that you really, really love and ultimately is really, really good for your health as well. Hopefully you found this particular episode helpful. There are 3 more resources just to mention, which again will be linked in the description. One of them is for care of self in terms of the decompression exercises you can do at home to take pressure off your herniated disc. Check that out, link in the description. We've also got the free Fixing Back Pain Masterclass if you need a little bit more instruction or guidance about your lower back specifically. Again, link in the description. And of course, we've got the Back in Shape membership to help you if you do need a little bit more one-to-one guidance in progressing through your rehabilitation journey and fixing your back pain for good. Hopefully you found this episode really helpful. If you know someone else who's been training, been plagued with disc injuries in their lower back and not quite ever able to get back into it, maybe it's your training partner, then consider sharing this video with them. Hopefully it'll give them a little bit of hope and get them back on track and back in the gym sooner rather than later. Thanks for watching, and we'll see you in the next video.